It's 11:13. We're gonna just sort of review the options that have been given to us. But before that, we're gonna do some introductions around the room, from some people who joined us today. And Mari, if you'd like to.
Yes, I'm real happy to have a guest. I love it when colleagues and areas come and visit us in the state house and see what we do. We start by introducing one of the group's leaders this morning, Darren Jared. Can you introduce yourself?
My name's Laura Darren. I'm a public health nurse and parent. And so I'm working with the University of Vermont School of Nursing in supporting the public health rotation. So student nurses will have experiences understanding and seeing how clinicians like yourselves, are involved in policy decision. And we're talking a lot about peer-reviewed research informed practice of policy. So we're hoping they'll actually come, a few times over their rotation at least, so they really understand the bills and see the process. So.
Will they perhaps be looking at one specific bill?
Yeah, they can actually, I think Tammy can speak to that a little bit.
Actually, I'm giving them they're open access to pick a bill of their choice and you're gonna write a little bit of paper about it. I know this would be a perfect experience for them to actually see it instead of watching it on video.
Tammy, do you want to introduce yourself?
Yes, I'm Tammy Reed. I'm an assistant professor over at UVM. I'm covering the public health practicum for spring semester. I'm also a nurse practitioner at Apple Tree Bay in Vermont. Thank you for letting us. Yeah, thrilled to have you here. And
I'm Brian Nunez. I'm a nursing student at UVM.
I can attest to that. It's been on my floor.
Ooh, that's a hard floor too.
I'm Estelle Haggard-Mark. I'm also a nursing student.
And I'm Lauren Miller, also senior nursing student. Yeah.
Great. My name's Catherine Ham. I'm also a senior nursing student.
Well, thank you, and we appreciate, we've talked a lot about workforce and this committee, healthcare workforce in particular, so the more nursing students, the better. So we're thrilled you're with us today. So I think we're gonna have our committee assistant, Kristen, put up a document that we've sort of been working on to try to coalesce what we've heard, and we'll keep that up on the screen. And I'm not sure.
I just did.
Okay, so it's just been posted.
Yeah, honestly, everything.
Yeah.
Then would be close.
Today, I just posted it as under the 82.
Eight.
Oh,
Also, I would call it
yeah,
HSPA.
I can change it. I just got it.
Yeah.
Do it real quick, but.
Safe over here.
Yeah.
I don't want to catastrophically destroy someone's.
We're gonna do some house cleaning
Later, yeah, I think we need.
a little later.
Things escalated over here.
Okay. So it's organized by sort of line items at the top. And then down at the bottom, I'm liking the color for. So we heard from Secretary Samuelson from AHS. She sort of went over a high level of money. And so let's look at the one-time appropriations, the sort of orangish, if you call it, on underneath. And, um, basically, does anyone have any questions? Can you scroll up a little bit? Oh, I'm scroll down, I guess. There. Does anyone have any questions, need further understanding about what these are? Any burning questions?
I think
Alan?
they mentioned that to us too, but under the one-time appropriations, the minus 1.9 million, the Medicaid consensus. What was that from the general fund?
I'm hoping that, Nolan, our JFO can weigh in
Okay,
on,
under the one-time appropriation, it says carry forward from SY 24, the Medicaid consensus needs minus 1.9.
That's probably just carry forward when we, you know.
So there's less need for the
Utilization.
Yeah, I think utilization was, yeah, budget was enough for utilization, probably, yeah. I'm not quite sure what's up with that.
Okay, that's,
so we over budgeted in fiscal year 24.
If we over budget, it would show, yeah, it's something, so that one I actually don't actually answer to, so I can try to track down my documents.
you can let me know.
Yeah, I don't think
It's not that important. Just didn't understand that one.
the other thing that's not on here. Which is some of the one times.
Yeah, that information came in this morning, so to us, that's why it's not on yet.
So that's the one thing I would say, don't forget that, and second, there are several things in yellow that you do not have to weigh in on because they're not in jurisdiction.
Yeah.
There's a CC map, there's.
So may I ask?
Yeah, of course.
Would you prefer that we just take them off? Or leave them a different color or what we don't?
We're gonna transfer all
Yeah.
of this onto the template that we used the last couple of years.
Right.
And next time we revisit this, we'll have it all in a format so that we can easily weigh in on our positions.
Yes. Yeah, so we're gonna take this document. And then traditionally in this committee, we like to use a spreadsheet that just orders things for us nicely, and then we weigh in on each individual line item, whether or not there's consensus among the committee, whether we recommend or don't recommend, or if we add anything or so we'll do that this afternoon and we'll finalize that. And then we'll send our recommendations to House Appropriations for this whole thing. I think I just wanted to use this time to briefly sort of look at what we've heard, just to see if anyone has any more questions on understanding what the asks are. So other than Alan I'm just gonna call them by the colored sections. The appropriations in orange. And that is I'm gonna call it a credit. I'm sure there's a different word for it.
I just didn't know what the Medicaid consensus,
Yeah,
I guess that was.
we'll get an answer for you.
Medicaid consensus is a process that we use to determine caseload utilization. Definitely mentioned it, and that's where you have AHS, financial management, joint fiscal. We get together and we go through all the different Medicaid eligibility groups and we try to determine what the enrollment utilization will be. And then they become consensus, and then we make proposal to the emergency board, and the governor and the vice chair all approve it, and that becomes the foundation for the budget. And the purpose of that is so that they're not fighting over the numbers, they're fighting over policies.
Thank you.
But what the 1.9 is, I'm not sure what
Well,
the is in the.
I figured it really not.
Okay, oh, you want to know that?
I just know what it was.
God, my
Okay.
apologies, I bet that's.
All right. So- Answered. Okay. Moving into the yellow section, and a lot of this doesn't pertain to our committee. But just wanted to see if anyone had any more questions about the ones that we did hear about. So like, we did not hear about nursing home bed days. That's under the purview of human services. And the anticipated nursing home EFRs, that's also theirs. But we did hear about Planned Parenthood. The Act 167. From each department, each area. We did hear about the ADS true ups. Today we heard about the ACO. Yesterday we had heard about PNMI. And we heard about CCFAP, or that's Human Services. And then we also heard about today from Diva about the prescription, the rebates, and that was just a lag because of the cyber attack last year. Any questions about any of these? Okay, moving down. DMH, that was the PNMI. And just increased utilizations, and that was their major ask. Any questions about that, understanding what that is?
But we have PNMI up in the yellow
Yeah.
box.
Yeah, the yellow box, I think, is just all areas. Just sort of the major changes.
So there's a fiscal amount in there, and then the one request just from DMH is separately.
I think that's because this spreadsheet was put, or this document was put together yesterday before we heard from
Oh,
Diva
got
and
it.
VDH.
got it.
Well, the question would be, do you want to continue with this kind of format? Or not necessary? That's sort of what we're trying to figure out. And we'll see what you come back with, which is great last year. So
Yeah,
it was just Woody trying to organize coming back in here from his appropriation head
yeah,
and communicate, to people who don't know a lot of this is new to, and to try and give some context.
I think we'll probably populate in more of an Excel form.
Like
Yeah,
Rainbow spreadsheets, and we could still populate narrative in there, like this.
And it just gives us an easy place to put yes, no, or unsure.
We're voting this out. Right.
I think we're just gonna do a straw poll on this afternoon.
Oh, I thought it was, no, Friday's the bill, I'm sorry.
Yeah, that's a
Yeah.
That's a possible vote on the bill. We don't need to vote on this, but we can do a straw poll. All right, so let's see, today we heard from VDH, the two asks in there were for the survey. That was just that it came in at more, so it was, I think, 150,000 more for the health survey. And I know that we use that information from that survey an awful lot in this committee. And then the Planned Parenthood funding for medications of $100,000. And I think that their biggest ask was actually around substance use, which does not, we're not asked to weigh in on. And then, so no questions about that? Oh, and the community grants from Health Equity, but that was more transferring from departments, so that was a transfer.
I had a comment about that. As I was
Yeah.
listening. I appreciate this committee did hard work in the past to establish the Health Equity Advisory Commission, to lay the foundation for an office of health equity, and I appreciated how it sounds like they're moving from the Agency of Administration to the Department of Health. That was the committee's original vision. So I just wanted to say I appreciate and strongly support that, because it's been a long time waiting for that to happen. I just appreciated that they're coming to us proactively to do that.
And if I recall from last year, didn't didn't we have to find them a home?
Yeah.
Yeah, it was a
And we
position,
found them
yeah.
home, so. Mari?
This is, I think, for a later conversation, but the topic of equity and DEI makes me concerned for what's happening at the federal level and what, do we need to do anything to shore up the agencies and departments that we have, like the health equity office.
I have questions at some point for Ledge Council too.
Do a grants for that, won't they?
I think, yeah. I've questioned at some point, just about will federal policy erase any of state policy around DEI, but we don't have to get into that today.
I mean, I think that that's a great conversation to have on the budget. This is just BAA, no more about, but right now we don't.
All right, so then Diva came in a little bit later. Their main ask around is caseload and utilization. So let's see, I'm trying to think what else.
Global payments.
Yes. The global payments, that's, and everybody understood that, that there's a lag time. Okay,
And we did that last year too,
we did that last year because they're moving global hospitals to global payments, so.
They're doing fee
And they, yeah, while they've got to pay the look back claims from fee for service while still providing the look ahead for the global payments.
Can someone?
And then, of course, the 10 million that they're asking for in anticipated emergency stabilizations to organizations, they would like to have that on hand and the ability to appropriate it on a quick basis.
seems low, but again, this is the BAA
Yeah,
budget, but it does seem low.
And it was only 4 when they first rolled out the budget. So the fact that it went to 10, it's great.
and 4 was presented to appropriations and within a couple days it became 10. I agree though, it seems low, but it's better than it was.
My only question, and I wish I thought of it when we had someone in here, is that it was originally appropriated to SUD
It was,
sites or organizations, and I wonder now if that they've increased it, if there's still 4 in there for those organizations, or like if it's earmarked for
My
them.
understanding is it is, but that wasn't heard in testimony, just in the hall. So take it for what that's worth.
Any questions around anything from Diva?
That's you.
My question is, yes,
Yeah.
is not about Diva specifically, but sort of what's the must do as opposed to where we have skills?
I think, well, the must do is, you can't change caseload and utilization.
Right.
Medicaid is an entitlement and people qualify and utilize services, and so we're required to do that. The PNMI, I have a really hard time with that acronym. PNMI caseload, we can't do anything that's, that's an entitlement as well.
UHCs.
The FQHCs, we
And
have,
nursing homes are-
and the nursing homes, it's either federal or state guidelines that require that they do that.
the dire straits.
The ACO settlement, that is, we have no say really in that. That is a truing up that they do every year.
ADS, no choice there.
There's no choice in the ADS. They've asked for additional for Act 167 healthcare transformation contract. If I recall, isn't that that they just needed additional for the contract that they had, or they're putting the contract out?
They put out an RFP
They put out
to do the
an RFP.
transformation that we required.
We
in it
required.
last year.
Yes.
Yeah.
I'm the Planned Parenthood, we, have some say over that. They're asking for that.
I only really see two, like, is that true?
Yeah,
That we can,
we're
can have input.
and I think that's
Really only two that are discretionary, it
Uh,
seems.
two of the larger items that they're asking for. The contract for the health survey is already, we heard it's in the field as of now, so
And it's 150,000.
it's 150,000. I think it. Other than that, I really don't think,
There's just not a lot of decision
there's
making.
not a lot of decision making at all.
It's usually in the BAA.
Yeah.
Just to be clear.
21 I see is the Planned Parenthood.
The 10 million for the,
Did you explain to our guests the BAA? Do you all understand what we're trying to do here?
so BA's is Budget Adjustment Act, even though as we were told yesterday, it wasn't an act, and yes, we'll let Nolan.
So every year the legislature passes the budget. The budget is what we anticipate we will spend in 12-month fiscal year. 6 months in, we have a budget adjustment, we have real-time data, we know how many people we're serving, we have a better sense of what our revenue is doing. And so all the departments come in, they get to adjust their budget saying, we need more money over here, we spent less money over there. And what a budget is, it gives spending authority to departments. So what they're asking for is a change in their spending authority of how much they're allowed to spend. Sometimes traditionally, you don't do new policy in budget adjustment unless it is very time sensitive.
We're allowed to. There's no rule saying you can't.
No, it's
Yeah.
more of a precedent.
A custom.
All right.
Custom thing.
Yeah.
So if no one has any questions about these individual items, I think what we'll do is we'll go offline and through the afternoon, we'll work on putting it in a spreadsheet format, and then just this afternoon, we'll just go through and do yes, no, and then we'll be done.
But we were gonna prioritize, and what we've had prioritized.
Yeah.
Not for BAA.
Not for BAA, just like, got it.
Yeah. All right, we can go offline.